Jesus, releasing destinies. This is Celebration TV. Jesus, releasing destinies. This is Celebration.
As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy budget to live well. Or imagine spending your entire income just to stay healthy. I am Dr. EMY. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT+1. Health Talks, your health, our priority. Talking about lifestyle and diseases, what should come into your mind is this: what do you take into your system? Is it good or bad? And what do you give out of your body? Is it adequate or inadequate? Life is all about give and take. You know, whatever you sow, so shall you reap.
The daily habits of a man, the attitude, the behavior, and the lifestyle of an individual will go a long way to determine the outcome of his health.
This brings us to today's health talk. I am Dr. Amy Momo and
I remain Dr. Brahma Keith. Welcome to Health Talk on Celebration TV.
Together we're going to take you into the lane, or take you through the lane of lifestyle and diseases. When we talk about lifestyle and diseases are illnesses or diseases that are attributed to the way people or person live.
The way that an individual lives, the lifestyle that they inculcate, the habits that they go through on a daily basis will determine how their health state will be.
Certainly. Do you know that the WHO says that in the year 2030, about 70% of people globally will die from these lifestyle diseases, which is also known as non-communicable diseases?
As at 2020, on a yearly basis, 41 million deaths occur globally from non-communicable diseases. And basically, these diseases are mainly diseases that occur as a result of our lifestyle. And that accounts for up to 71% of deaths globally. That figure has just been overtaken by the era of COVID and infectious diseases. Now, in Africa, basically, what we had in those days were the incidence of infectious diseases killing people. But now it has been overtaken by diseases that occur because of our lifestyle.
Of course, you know, now the world is now a global village, and as kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy budget to live well. Or imagine spending your entire income just to stay healthy. I am Dr. EMY. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT plus 1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to live well. Or imagine spending your entire income just to stay healthy. I am Dr. Amy. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT plus 1. Health Talks, your health, our priority. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to live well. Or imagine spending your entire income just to stay healthy. I am Dr. Amy. Join me and my colleague.
Welcome back to Health Talk on Celebration TV. We apologize for that break in transmission. We're discussing lifestyle and diseases, and Dr. Amy is still here. Now, we said that almost every individual, especially in Africa, has at least one risk factor or one chance of them coming down with a deadly lifestyle disease.
Yes, and you know, it was actually known as the Western disease because of the lifestyle and other behavioral factors. But now this world is now a global village, and other places or other parts of the world have now adopted this Western world or industrialized lifestyle. And because of this, these diseases are now in developing countries such as Nigeria and other countries.
More than 70% of incidences of this are found in low and medium income countries. So it's no longer a disease of the Western world.
At all.
Lifestyle diseases is a disease of the global community, and that's because these lifestyle changes cut across every almost every age, tribe, and continent. Actually,
today we're going to be talking about 5 main lifestyle diseases. 5 main ones, and in this they include obesity, diabetes, coronary artery disease, cancers, and hypertension.
And we know that though we tend to just name them lifestyle diseases, we know that there's a strong genetic basis for these diseases.
True.
That there's a strong family history. When any family member of yours has a particular disease, there are chances that you are going to have them. However, your lifestyle will increase your chances of coming down with these diseases.
Exactly. Exactly. So talking about this, we'll love to tell our viewers about the first one, obesity. Yes.
Obesity is a common disease generally worldwide. In Africa, those days we were battling with undernutrition. People were on the slim side, they were malnourished. But these days we see a lot of people coming down with obesities, either in childhood or even as adults. And this disease comes with its own complications. When we say an individual is obese, we are looking at what we call the body mass index.
Of course.
We are calculating the weight of the person
over the
height in square meter, in meters square. Yeah.
Yes.
And then we have a particular value,
of course,
that we say an individual is overweight or obese.
Yes.
So once your body mass index starts hitting 30 and above, then that individual is obese. Some can go as high as 40, which we call the morbid obesity. That obesity that will almost always lead to death if something is not done immediately.
Yes.
And then apart from the body mass index, we also use the abdominal,
of course,
abdominal obesity.
Of course, that's the truncal obesity.
Yeah.
So we have two types of obesity: the usual, the normal obesity we just explained, and also the truncal obesity. In the truncal obesity, or one who has truncal obesity, the body mass index (BMI) might be normal, but the person has this fat accumulation of fat in the truncal region, that is the abdominal region. Yes.
And abdominal obesity is also associated with the same complications that people who have a high BMI also have.
Yes.
So there's no escape for it. Whether you have just abdominal obesity or you have a high BMI, then an obese person is an obese person, and they come with their own complications.
That's true. We have a number written in the screen. We have a number on the screen. Please feel free to call us, share your views, share your questions. We are here to answer you on this topic and any other topic as far as its health issues. Thank you.
Now, for obesity, for people who are obese, the common challenges that they will have. You know, basically, when we talk about lifestyle disease, we have said whether the individual is active or not active, what the person eats and how he eats it, and then the extracurricular activities that the person engages in.
True.
Yeah. Now, for obesity, we find out that though there is a strong family history, some people would also have obesity because of the way they eat.
Of course.
Yeah. And some people engage in a sedentary lifestyle.
Yes. Remember during the introduction we talked about what you take in and what you give out. If the calories you take in is more than that you burn out, of course there's an imbalance and obesity will come in. So they ought to, for you to be a normal weight, you have to have a balance between what you take in and what you give out. When we mean giving out, we're talking about exercises. And when we mean taking in, talk about the kind of food you eat, how you eat it, and how many times you eat it. All these contribute to obesity.
And obesity is a very strong risk factor for both hypertension and also diabetes. And you find out that people who are very fat, with time they start coming down with arthritis of the knee because there's so much weight that's pulling down on their knees. And they also come down with other skin diseases that are common, and they also come down with gallstones. You see them having stones in their gallbladders. And
hypertension, of course.
That's a very common one.
And most times they can come out with diabetes also, of course.
Very common.
True.
So, and for obesity, basically, that we have said as a lifestyle disease, we say diet is a very core incriminating factor.
True.
So when people watch what they eat and the way they eat them, it will go a long way in controlling obesity.
True. And another thing we've noticed, have you noticed the childhood obesity has actually increased? We see little children now becoming obese. And of course, this industrialized or this kind of attitude of living, those days when we were young, remember now, we always go out, we play football and outdoor activities and now. But no, that's not so. Children just stay inside the house, watch TV and play games. And so what happens? That sedentary lifestyle comes in. They do not let out these calories. They do not do exercise. They do not burn out these exercises. And of course,
childhood obesity is on the rise, and they also have the same problems that adults will have.
Of course.
And an obese child is going to be an obese adult, and they will have same issues cropping up later. Now, because the world has changed, children stay more. You see nowadays parents will just give their children burger when they are disturbing them, and they go and eat. They play games, they watch TV, they do not go outside to play, and then they start piling up fat and adding weight.
And also their attitude, some attitude towards feeding. You imagine this. I saw a lady who came and she backed her child. You know, in Africa, we back our babies and our back and all. And she complained, like, doctor, my child is not eating. I've tried this cereal, I've tried this meal, that meal. The child was about 6 months old. I tried so many things. I'm worried. I just went to get pap now. I was okay. Let me see this child. Lo and behold, the child is obese.
You know, it's a common misconception here.
My goodness.
When you are not fat, it is believed that you are suffering.
Do you know, I felt pity for that child, because she had eaten enough and she was tired of what? She was tired of eating.
Yeah,
and the mother kept forcing her and complaining that the child is not eating enough.
And they want the child to be chubby. But there's a slim line between normal weight, being overweight, and tilting towards obesity.
Yeah.
It's common when people want to feed children and make them appear good, not knowing that sometimes we are tilting them towards becoming obese.
Of course. And another disease is the diabetes. Diabetes mellitus. Diabetes mellitus has been implicated as one of the lifestyle diseases. There are two types of diabetes: diabetes type 1 and diabetes type 2. But the one implicated in this lifestyle disease is the diabetes type 2.
Yeah, we know that in diabetes there's also a strong family history.
True.
Yeah, somebody has, your mother has, and you are going to have diabetes. Of course. But however, even if you don't have a family history or you have a family history, the way and manner that you eat food will further increase your chances of coming down with diabetes. So it's common, because when you eat a lot, you're going to become overweight.
Yes.
Yeah, and being overweight in itself would cause insulin resistance.
Of course.
Even if you have insulin, the body is not taking in the insulin as it should, and then people start tilting towards diabetes mellitus.
Okay, at the moment, we're going to take a break. When we come back, we'll give you in-depth information on the diabetes mellitus in relation to lifestyle disease. Thank you. Hold on, don't go far. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy. Join me and my colleague Dr. Keats on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV. Live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT plus 1. Health Talks, your health, our priority.
All right, welcome back. We're still on Health Talk, still discussing lifestyle and how it causes diseases.
Yes.
Yeah. So we discussed obesity as one of the lifestyle diseases. Now we'll quickly take a look at some of those symptoms of an obese person. Of course, an obese person, generally they'll see that they are big.
Of course.
Yeah. And then they can now start having sleep problems,
of course,
breathlessness, because of the increased weight that they have.
Yeah, that's sleep apnea.
Sleep apnea. They tend to snore.
Yeah.
Because there's enlargement. Generally, their airways too may be blocked.
True.
And then they may have problems walking, like we said, because of the weight that is pulling down on their knees.
And also they have they sweat a lot, and so some of them may have body odor because of such sweating,
because they are unable to cope also with physical activities.
I'm talking about their psychology also. You know, body shaming, they feel so sad knowing that they're overweight, and they might not actually have confidence in themselves. So those
it's one of the psychological problems that obesity can cause for people.
Of course.
And then the other lifestyle disease we're talking about was hypertension.
Okay.
So that No, diabetes.
Diabetes,
sorry.
yes.
Okay, in diabetes, we've been able to establish that people can become diabetic either because they have a family history,
Yes.
and it can also happen because of the way they eat food.
Yeah.
Now, it can increase their insulin resistance and they become diabetic. And diabetics have a whole lot of problems.
That's true. Talking about diabetes mellitus, let's tell our viewers about it. You know, it is the rise in or an increased blood glucose increased blood glucose level, sorry, and this is actually caused by insulin resistance. When the insulin is resistant or the receptor it's not responding, or when there's a low production of the insulin, that is diabetes type 2, and all this amounts to increase in the blood sugar level. And so talking about lifestyle and diabetes, you can imagine a person who has the history of diabetes. Remember we talked about hereditary or family history, and apart from that, the person start eating so much and eating refined sugars, eating lots of food. So such sugars affects the insulin, because normally the insulin helps to mop out sugars into the cell, and this is weak. The insulin is weak, and so it kind of overweights this insulin, and what happens? It cannot function as usual, and that is when diabetes mellitus type 2 comes in.
Because of the dietary approach of people with this, because the body releases insulin in bits.
True.
Is the hormone that mops up the sugar. All the carbohydrates that you eat will be turned to sugar in the body during absorption. Now, and these sugars are taken away from the body by insulin to be stored, and it uses the others for energy generation and all that. If you now overwork the body by pulling a whole lot of sugar per time, or by taking sugars consistently over a long period of time, especially the refined sugars, the processed sugars, not the natural ones per se, then it increases their chances of coming down with diabetes too.
Okay.
There's a question. They say, how can I reduce my pot belly?
Okay.
But we'll deal with that when we come to preventive methods. To reduce pot belly, all you need is, now, because you want to lose weight doesn't mean you should not eat.
Okay.
And weight loss is not an aggressive thing.
But talking about this pot belly, you know, pot belly is also called truncal obesity. And there are so many things that can actually cause this. You know, we said the person might have a normal weight, normal BMI, and still have this big tummy. The question you ask yourself is, what am I taking in that's causing this? Abdominal fat can be caused by various things. Like one that I noticed as a doctor, that people that come in with this, come to my clinic and complains of this. I ask them one question: when do you eat at night? And they're like, and what do you eat?
What do you even eat?
Doctor, I beg you. I don't play with my pounded yam at night. Oh no. By 10 o'clock you stay eating high carbohydrate food. What happens? Then alcohol also. It has been shown that alcohol contributes to this truncal obesity, which he calls pot belly. That's the colloquial word for
so
it.
To cut down on pot bellies, according to that question, it just needs diet, discipline, exercise.
God bless you.
Diet, eat a balanced diet, like we always say. Your diet should still be balanced, but however, you cut down on high carbohydrates, especially refined carbohydrates, not the natural ones, those processed sugars and all that.
And eat fruits and vegetables.
A lot of fruits and vegetables.
And also, you know, people with such also they might have this high cholesterol. Yes.
And fatty liver.
And fatty liver. So what happens? They have to take meals that will prevent this high cholesterol. Avoid what? Fatty food. Then what? Yes, fatty foods and red meat and other.
And then being engaged in physical activities.
And exercises.
We'll take care of that one.
True.
And then another common lifestyle disease that we see are some certain forms of cancers.
Yes.
Breast cancer are associated with obesity.
True.
Colon cancers are associated with diet.
That's true.
Cancers of the intestine are commoner in people who do not eat a whole lot of fibers and vegetables.
That's true. But before we go to that cancers, man, this topic is kind of interesting, like seriously. And talking about it, we talked about concerning the diabetes and all.
Yeah.
So talking about the complications of diabetes. Yes.
Okay.
So having diabetes one can have so much complications.
It's a multi-systemic disease.
Yes.
Every system will be affected. For diabetic people, they can become blind.
Of course.
They can have kidney failures.
Yes.
They will have wounds that will refuse to heal, and it may lead to amputation. Yeah, they may just slump into a high glucose level,
and they have
the individual passes on. So it's something that is serious that must be managed.
Yes, and all. So you can see that the complication is enormous, and so one have to be very, very
careful
and very, very careful
and
on what to do. Yes, and also it has been shown that if one cuts his watching diet and also go on exercises, it will
exercise, weight loss. Yeah, weight loss alone will also help. Yeah, avoiding a sedentary lifestyle, avoiding junk food, and then engaging in exercises, quit smoking and alcohol. All those ones will help to prevent diabetes in individuals.
Of course. So back to the cancer we talked about.
Yeah.
Cancer is, it's also one of the major causes of this. I mean, a cause of this, or a disease associated with lifestyle. It's a disease associated with lifestyle, and unfortunately, it's growing every day. Before, we heard about cancer in, like, for example, in Nigeria, we used to hear of cancer. And we're like, what is cancer? Oh my, it is strange. But now it's everywhere now. Yeah.
Another lifestyle that we really did not emphasize on is the things that people do in their pastime. We've talked about alcohol and smoking. Now, there's also other cancers that are associated with viruses. Okay. Cervical cancer. Okay. Yeah. It's been known that the cause of cervical cancer is a virus, and it is sexually transmitted. Okay.
So that brings us to the habit,
Yes,
alcohol, smoking,
that's still the habit.
Even illicit sexual affairs and all, premarital sex and all,
can actually expose people to cancer. Yeah. There's a new research now on prostate cancer too. Is in fact, of course, we know that diet is also implicated. There are some metabolites, some chemicals now that have been seen to be very high in people who have prostate cancer. Okay. And many of them are coming from diet. The enzymes in their intestines break down food and produce harmful metabolites that increases the chances. They cause very aggressive form of prostate cancer.
You can imagine what you eat actually matters.
Will determine how long you will live.
Okay. Talking about colonic cancer, that's colorectal carcinoma. It's same. When one eats a lot of carb and a lot of canned foods and processed meals and all those stuff, and do not take high diet, high fiber diet, what happens is that this food stays so long in the bowels and it gives time for this metastasis to occur. Thereafter, cancer comes in. That's colorectal carcinoma.
So you would understand why in Africa our grandfathers lived longer than people live these days. Yes. That's because they were more exposed to natural food. Sure. They ate the straightforward cassava, which contains a lot of fiber. They did not have access to these processed carbohydrates in noodles, spaghettis. They didn't have access to refined sugars. They didn't have access to processed food, corned beefs and all that. So because of the natural ways that they lived, their health was a bit prolonged compared to now. Okay, this is a question. It says, what causes fibroid in a woman's body? This one is from Olaniya Adeoye. Well, fibroids, we call them, they are benign growths. Yes. They are not cancers, but they are growths that occur in the uterus or the womb of women. Yeah. Almost every woman will have a fibroid.
But most of them might not be symptomatic.
Yes, many of them are not symptomatic. If you take 10 women together and you do a scan, about 7 to 8 of them will have fibroids. but many of them may be small and they won't give them problems.
At all.
Yeah, the risk factors for having fibroid, because you are a woman already, will increase you to chance of having a fibroid because you have a womb. And then another one is infertility. Some women, you know, God has designed the womb to carry a baby.
Of course.
If it doesn't carry a child, it will carry a swelling.
So the body will kind of form a fibrous tissue
around
like
it.
in the womb, like a baby. That is the fibroid.
So for women who do not get pregnant frequently, they are at risk of also having uterine fibroids.
Then the age also.
Yeah, with increasing age, as you age, you see fibroid is commoner in women who are in the reproductive age. Once they hit menopause, they are no longer menstruating, the incidence of fibroids will drop.
And the female hormone estrogen is actually implicated in that. Female hormone. So as a woman already, you actually have the risk of having
a fibroid.
So there are risk factors to fibroid, but when you say this is the thing that is causing the fibroid, no.
We can give you some certain things that are present in you that would increase your chances of having a fibroid. However, most of them do not cause problems, except it is causing problems. That's when you should be particular about removing the fibroids or not.
Of course. So please feel free to call us. You have the number in the screen. Feel free to ask some questions, to call us. We are here to answer your questions on this topic and any other medical topic or issue.
Yeah. Okay, now
talking about cancer.
Talking about cancers as a lifestyle disease.
Yes.
Then there's another common one is the dyslipidemias.
Okay. That's the
abnormal lipid levels in the body. You know, it's common. People talk about cholesterol.
Sure.
Yeah, cholesterol they are fats, anyways. But we have the good cholesterol and the bad cholesterol. Yeah, not all cholesterols are bad, anyways. And then some cholesterol are produced by the body on its own.
Yeah.
While some cholesterol comes from food.
The food.
So most times, the diet that some people have a family history, what we call familiar hypercholesterolemia, where their families have a problem with cholesterol. Sure. They produce a high level of cholesterol, and the cholesterol tends to block their blood vessel.
Yes.
It will lead to hypertension, to go and cause so much fat to gather in the liver,
liver
and then increase their chances of diabetes too.
Of course.
While for some, it comes from their diet. So cutting down on high fatty food will reduce the incidence of cholesterol levels in them.
Yes. So you can see whatever one taking matters a lot, and what you give out actually matters a lot, and so that is a habit and all. So talking about preventions of cancers, because you know there are various cancers. We talked about colorectal cancer, and there's even breast cancer, of course, and
for lifestyle habits that is implicated in that one is mainly obesity. So if you can cut down on your weight,
even the breast cancer,
the chances of that one will reduce.
It's true.
But there's something quickly that our viewers must know. There are some people they'll tell you that because they are not fat or they are not obese, they are not at risk of some of these diseases. We have seen very slim people that have high level of cholesterol.
It's true.
Yeah, and then they also have the same problems that fat people will have.
It's true.
Yeah. So some people will eat and eat and eat all the levels of junk and they won't get fat, and yet they think that they are free from complications of poor feeding.
But actually,
they also have those same risks too.
Yes, so thank you for the information. I'm sure they will be very excited knowing this information. So talking about cancers and the preventions of cancers, because sincerely speaking, cancer has been ravaging this country, not just this country, ravaging the world. It's a world problem, and now it's associated with lifestyle. We can see it as being associated with lifestyle, smoking,
alcohol.
Exactly. So to prevent this, one should avoid smoking. Do not smoke, because smoking can cause lung cancer. Yes. And also
sunscreens, those ones will prevent people from having skin cancers.
Yes.
Then we say a lot of vegetables are to cut down fat.
Remember, colorectal carcinoma. It's lots of vegetables will prevent what?
If you eat a lot of vegetables, that will clear your system almost every time. It will reduce them. We say eat moderate amount of protein, stay active, avoid a sedentary lifestyle, and go for regular medical checkup so that this can be detected early enough.
Exactly. And one shouldn't forget to live a godly life, because remember, illicit sex can cause what?
Human papilloma virus that cause cervical cancer.
Cervical cancers
in people.
Yes. So once lifestyle and all happen, it's involved or in these diseases we just talked about.
So in preventing generally lifestyle mediated diseases or diseases that are caused by lifestyle, we must look at some key factors.
Okay.
Yeah. The diet of the person is an important aspect.
Very important.
Yeah. Then whether the person is active or not. I had a patient, a 10-year-old girl was brought in by the mom.
Yes.
Child was obviously obese and the mother was worried.
Okay.
Yeah. We didn't do anything aggressive for her. We just told her to cut away from processed carbs and high sugar drinks. We took away Coke, took away Fanta, took away all those fizzy drinks. It will surprise you to know that a bottle of this fizzy drink will contain as high as 8 cubes of sugar that ordinarily you will not swallow, but they are just in one bottle.
Imagine.
So we cut off those ones, and we encourage the child to be enrolled in a swimming, in a tennis group.
Okay.
She played tennis. In 3 months, weight loss.
Wow.
Yeah. So we didn't starve her of food. We just maintained her on the same balanced diet, but we cut off the carbohydrates that are very problematic for them.
And also, apart from the cutting off or reducing carbs, the time or the interface at which one eats matters.
Yeah.
I had someone when I was in medical school, and she was kind of fat, obese, and we wondered why. She's like, I don't eat, or I don't know why I'm getting fat, or I'm like, hello, is for real? And the roommate said, we're all working together. The roommate was like, don't mind how. In the night, about 1 a.m., I hear some noise. Chi, chi, chi. She has gone to eat bread. She has a full loaf of bread for 90. She said 1 a.m. she wakes up to eat. Imagine.
That's the deception with people who try to lose weight. They starve themselves, and then when they want to eat, they eat to compensate for the periods of starving. Yeah. It doesn't help.
No,
it worsens the problem.
Yes.
So it's now in weight loss therapy, it's something that you discuss with your dietitian and your doctor. In fact, your dietitian should be your closest person if you want to lose weight.
Yes.
We say that moderation is key.
Of course.
Yeah. Be moderate in whatever you eat. You know, there was one time they came up with the ketogenic diet. It's not very common again these days. I think it failed many people. What they did with the ketogenic diet, now the keto diet initially was done to manage epilepsy. Okay, I think we have a question.
Yes,
sir.
we have a question.
Good day, sir. Ma, please, what causes adenomyosis or endometriosis, and is there a possibility of conceiving with these conditions? From Jessica Jonathan. Thank you. Well, adenomyosis and endometriosis, they are not they are different from fibroids. In adenomyosis, the muscle in the uterus itself, is having an overgrowth.
Yes.
Yeah, and is more difficult to manage compared to fibroids.
Sure.
In fibroids, if you want to remove fibroids, you just go and remove them. But adenomyosis is a bit more difficult in the muscles itself. And endometriosis is when the tissues of the uterus that usually menstruate out every month,
the lining covering the
they now leave the uterus and they can be anywhere else. Yeah, they can come to the cervix and they cause severe menstrual pain, some severe bleeding and all that. There's a possibility of conceiving with these conditions, yes, especially if it is detected early enough. But before you can diagnose somebody to have endometriosis, you must have done a biopsy. Take off the tissue and check whether it is uterine lining tissue that you have. it's possible for them to get pregnant with
Yes.
these conditions, depending on how severe
it is.
that
But
it
the
is.
more severe, the less
The more severe, the less
the
chances
less
of getting
chances
pregnant.
getting
But
pregnant.
it can actually be managed. I think you should see your gynecologist,
You will
and then they
sure.
review properly
Exactly.
and decide what can be done for you. Some of them are amenable to surgery.
Yes.
After
yes.
surgery, you get better and you can conceive.
Yes.
Thank you, Jessica.
Okay. So back to what we were talking about, the prevention of this. We talked about obesity. I mean, talked about feeding rather.
Yeah.
Feeding, one's diet and how it affects and all. So, and we talked about counseling also, which is very
which
important.
is very key. You must work hand in hand with your dietitians and your doctors to cut down weight.
There's another question.
What causes menstrual cramps? I've been taking drugs since I was 10,
Wow.
but the pain keeps increasing.
Okay, that's dysmenorrhea. We would have menstrual
Well, dysmenorrhea, we don't know now whether it is primary menstrual cramps or secondary menstrual cramps.
But usually when when the endometrium wants to slow up, the endometrium is kind of the lining in the womb. Yes, and so when it's time for menstruation, it slows up, and there's this kind of contraction that the uterus have to undergo, and this contraction, and they undergo to remove this blood and remove this endometrial lining.
Yeah.
This contraction gives these pains that they feel, because of course some endorphin, some pain receptors are involved in it.
I don't know how old she is now, but it says since she was 10. But we know that primary dysmenorrhea, that's just pain from menses without anything causing it. It's common in young women, but as they age, it gradually clears.
Yes, as they age, it clears.
But for some people, they will still carry on with menstrual pain even as adults, even when they start bearing children.
Exactly, and that does not mean that it's any pathology.
It doesn't mean that there's a pathology, but when it now becomes severe, it is something to look into.
Sure.
It may just be endometriosis.
When endometriosis, they have this
severe pain. And then the way you use your drugs also matters. We tell people that you start using drugs for menstrual pain 3 days before your period starts. Because when you start it on the day of your period, after the pain has started, it usually will not have effect as if you have started it a few days before the menses start. So I think you should do that. If it still doesn't clear, see a doctor. You may be having what is not primarily a menstrual cramp. There may be something causing that.
Mostly when the pain is really, really severe. It might just be due to endometriosis or anything. Okay, thank you.
So we were saying, please, what kind of drink with children with obesity take? Let them go for fruit juice. Water is very good. Natural fruit juice, it's fine, rather than taking these fizzy drinks with refined sugars and all that.
When we talk about natural fruit juice, if you have the time, create your fruit juice yourself, because the ones they call natural that are packaged are not actually natural.
They are not. Once they start putting processed and seasonings and preservatives, they spoil the whole thing.
So another thing also is, please make sure your children groom your children up to be used to water. Do not give them juice anytime. You can't give your child a lunch and you give juice, breakfast, juice, dinner, juice. No. Please encourage them to take water. And when you have an opportunity, or when there's a time that you give them juice, ensure that it's not going to be frequent.
And if, for example, if for their snacks when they are going to school, instead of putting in your fried foods, why don't you put in oranges, apples, bananas, and let them use those ones as snacks instead of the fried foods and all that.
Okay.
At this time, we're going to go on a short break. Stay with us. We'll be back in a short while.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet.
Alright, welcome back. It's good to know that you're still there. We're still talking lifestyle and diseases on your darling Celebration TV. Dr. Amy Momo is still here. Yeah, Dr. Amy, we're talking about how to allow our children. The question was, a child is already obese, what drink should they drink? And we've said that instead of making them get used to fried foods, why don't we put in fruits as part of their snacks when they go to school?
Exactly.
Yeah. And then for that question, it is not just about drinks alone now. Also watch the sedentary lifestyle that the baby lives.
Sure.
Try to keep the child active.
Exactly.
You can take away the video games for a while.
Yeah, you should go outdoors.
Allow the child go outside and play and watch generally what the child eats. Exactly. Get them to be engaged in physical exercises, which is also very important. You may not need to register the child in a gym, or get them to do exercises.
Yes, we're talking about prevention and all. So we talked about some prevention, important prevention, talking about the food you eat and all. Then let's talk about the solution to this.
Yeah. Now, if you're looking at that, you take every of the lifestyle disease. Yes. Now, we have said that for somebody who doesn't want to come down with lung cancer, quit smoking. Exactly. Not just, there is the second-hand smoke. Yeah, somebody smokes around you, especially your baby. If you have a father who smokes and the child is exposed to smoke, it is also a problem.
Of course.
So it's not like a family thing now. Everybody will be at risk of lung cancer. So quit smoking, quit general risky behavior.
Yes.
Risky behavior. Alcohol intake.
Then avoid refined sugar.
Illicit sex. Avoid refined sugar. For hypertension, we tell people, some people have hypertension and with dietary control alone, they are able to control the hypertension.
Yes.
Cut down on salt intake.
Exactly. Salt intake. Cut down on red meat and fatty foods. Of course, do exercises.
Lose weight.
Lose weight.
You know, if we talk about exercises, a lot of people want to argue with you. You see, people who are not fat, who are not obese, usually do not see any need for exercise.
Because they feel exercise is just to reduce the weight. But that's not true. To keep you fit and healthy, for your cardiovascular system, your blood and all to be normal, as in for your heart to pump well, you need exercise.
Now, an exercise does a whole lot of things.
Yes.
From mental to physical to the heart to psychological. After exercise, you know there's a release of these endorphins. It makes you feel good.
Fresh and good.
After exercises and a cold bath, you feel very good. Now, for exercises, like we say, you may not necessarily be registered in a gym before you do exercises. Okay, I think we have a question. It says, good day, doctors. Please, why am I having milk in my breast and I am not breastfeeding? Can this affect my chances of getting pregnant? What can I do about this? Okay, thank you for your question.
It can affect. You know, this is we're talking about what prolactinemia. Yes, usually we expect milk to be in the breast when the woman is lactating, when a lady just gives birth and all. And this actually causes what we call lactational amenorrhea, meaning people that are breastfeeding and milk comes out from their breast, they might not see their normal monthly flow because it kind of stops this hormone, the estrogen and the progesterone hormone that is there, which regulates your menstrual flow and regulates the fertility. It actually hurts it, put a hurt to it. And so having this milk let down or this, it can actually affect. But another thing is, what is actually causing this problem? What is it? What's the cause? There are some...
For her, well, unfortunately, she didn't state her age.
Okay.
And she didn't state whether she's married and she has been trying to conceive.
Yeah.
People can have milk coming out of their breast because of a high prolactin level,
yes,
like you have said.
Yes.
Now, for some people, they may be having milk coming from their breast and they can still get pregnant.
Of course.
It depends on the level.
The
too.
level, yes.
Yeah. But if it is too high, it can prevent them from getting pregnant. And then, is it just straightforward high prolactin level? Is it a tumor?
Or a syndrome like polycystic ovarian syndrome?
Yeah. Some people, like I'll ask now, unfortunately I may not be able to get answers from her. Is she having unusual headaches?
Okay, frontal headaches.
If it is a tumor, for example, they can be having headache. When we say a tumor, we mean a swelling in the brain. It may not be cancer.
No.
Yeah, it may just be a benign tumor that's compressing on a part of that place.
Exactly.
People who come with breast milk discharge without being pregnant, they may tell you that they are having those kind of headaches, and you start suspecting that. But before you can say that it's high prolactin level, you must go through a test.
Yes.
You have to do a blood test for you to know. And if it is prolactin that is high, there are drugs that can be used to control it. It will stop and you will get pregnant.
Another thing that can cause this is stimulation. There are some ladies that
sometimes it happens like that when they are stimulated.
When they are stimulated maybe by their partners and all, such will not actually cause infertility.
It won't cause infertility.
But what we advise is, okay, let your partner stop the tactile stimulation and all, so
and
that it is
just see a doctor for that. And then for exercises, like we said, there are several exercises that you can do. Walking, brisk walking for 30 minutes in a day is exercise on its own, and it will suffice. While some people can go hiking if they can.
Yes.
They can go swimming, dancing. All those ones are exercises that will help to lose weight, keep you fit, keep the heart also fit, and give you cardiovascular stability and balance.
Wow, this was a very awesome discussion today. I guess you all enjoyed it. Thanks for staying tuned. But for today, we have to draw the curtain close. This is Health Talks, and have a wonderful day.
It was nice knowing that you were there. Thank you.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet.